And we're going to be talking about hospitals, and I think hospitals are going to kind of be recognized in the coming days. So I guess let's start off with Kevin, and you can kind of tell us about what is a hospital week that's coming up?
Next week. We're excited about it.
Okay, so hospital week is a chance to recognize, if I'm not mistaken, the impact that a community hospital like Mahaska Health has on Mahaska County, Oskaloosa, New Sharon, all of those places that are just right next door. So
yeah, we have a full week of events planned next week, and it's to celebrate our employees, our care teams, our providers, our nurses. We're just thankful for all of them taking care of this community, taking care from public health, community health, our satellite clinics, our partners at William Penn, our new Sharon Clinic, and so we're just excited to celebrate the people that are taking care of patients every day.
And Gayle, you're gonna have a small part in all of this too.
Well, I am very fortunate in the fact that I do get to see patients every day, and I'm very blessed to be able to do that. I work both here at the Oskaloosa campus and at the New Sharon campus. I have a partner that we trade back and forth with, so one of us is available at one of the places 5 days a week.
Okay.
No, so many services are expanding at Mahaska Health. We now have 21 primary care providers now. We have 6 family practice OB physicians. We have a 3rd general surgeon that joined us, Dr. Jesse Van Manen, and also we have pain management here with Greg Cronenberg. He's a fellowship trained CRNA. We have rheumatology will be starting up soon with physician assistant Libby Dassow. Kelly Dolly, she's a nurse practitioner here that's transitioning from family practice to neurology and sleep medicine. We're also expanding cancer care at our facility. So Dr. Brad Hyatt will be coming down to Mahaska Health 2 days a week. We have Dr. Dan Kolmorgan, who's a surgical oncologist, is serving as our medical oncology medical director. And also we have Dr. Allison Smith, who's a radiologist, serving as our medical director of radiology. So we're just thankful that we have a lot of great people joining our team and just taking care of patients.
And I want to say that it is a huge service to the community to offer those things locally. A lot of our people that need this care, travel is not easy for them. So to have it locally speaks volumes. And I think it speaks volumes for the commitment of the community and the hospital to get those people here so that we can provide full service to our patients.
Well, I was going to say, so attracting providers to a hospital, a facility like this is not easy. So kind of, briefly, if you can, tell us what's helping bring those folks here. Is it the community? Is it the package? Is it the people? I mean, so really, what kind of special juice do you got going on that's helping bring those folks here?
I'd say number one is a healthy culture, right? If you have a great culture of people working well together as a team, that's really attractive. And so our new physicians and providers have really enjoyed that. And so we're thankful for our new people joining. And the other piece too is we have high school students. We reach out to residents early on. We do have a 10-year recruitment plan as well. And so when we're talking early with folks, especially those who are from Oskaloosa or who are from the area, we want to make sure that we're visiting with them early, and so they become very interested in what we're doing here at the hospital and how our teams are working so well together.
Okay.
I really think rural medicine is transitioning, and I think people are figuring out that it's maybe better than the big city medicine. It's certainly more personable. Some of my patients, I call them generational patients. I can remember when they were little kids. I can remember when they were having families, and now they're adults with elderly parents, and I know them generationally, and you've developed trust that way.
Mm-hmm. So then you believe that all helps, that trust, that small town value, maybe a changing mindset of that's taken place is also a contributing factor to help bringing talent here to town.
It is. A great example of that is Arthur Zahadias. His brother Mark Zahadias and his wife Alyssa, they joined our group in 2018. Well, his brother, Arthur, was practicing in Chicago. And was like, hey, we really enjoy small town living in Oskaloosa and the hospital here and the patients. And so Arthur came on a visit, fell in love with the place. So him and his wife moved to Oskaloosa and bought a house. And now he's our public health director and occupational health director. So that's exciting.
You know, we've kind of we've talked a little bit about attracting that talent, finding that talent. It's difficult because, as I don't want to say difficult, that's probably not the right word, but as the service lines here, or the amount of things that you're offering patients locally continues to grow,
Yeah.
You guys are finding that talent to help fill those roles, evidently, then, pretty easily.
We are. It just takes the right person. You know, Gayle is just a great example of that. Gayle reached out to us, and she was going to school to become a nurse practitioner, and what she's done in New Sharon with Jessica Tokel has just been just awesome. The patients up there, the community, how they're plugged in, how they care for patients, how they care for Missy and Todd up there who serve patients with them. It's just heartwarming to see what Gayle and the team is doing. And so if we have a physician or a provider who really has a passion for people, patients, want to live in our community, we will talk with them and visit with them and share what our culture is. And so it really is fun to see people to join our team and have that passion to take care of others.
So, do you get a sense of satisfaction seeing that interaction, you know, with patients and the community and people enjoying themselves through that whole process?
You know, it really is very satisfying to make a connection with the patient and help them have better health in whatever way that be. Even if it's just moral encouragement. They may have never had that before. And if we can supply that, we're more than happy to.
I was going to say, Kevin, as the leader of the pack, so to speak, I mean, that's probably one of your primary focuses is to have happy employees, have satisfied employees, and a community that's getting the services that they need.
Yeah, it's just an honor for me and our leadership team and our physician leaders to build teams in a way where not only are they caring for each other, but they're caring for patients, and that's just exciting. The many stories that come about of how patients have been positively affected and cared for, and preventative health care implemented by our care teams, it's extremely satisfying, and I just love what I do every day.
Because we know these people and we have established relationships with these people and we see them in the community. We have summer's coming up and we have a lot of parades that we do, and we try to go to all the local parades. And I shouldn't say summer because we do winter parades too, right, which are always interesting based on the temperature. And I try to bring my grandkids to this all the time and involve them and let them see what we do and how it's basically caring for the community. We have office hours at William Penn Clinic, and that's always lots of fun to see those young kids out on the first time and hear their stories, and they're just some pretty impressive kids. And then my partner and I do sideline coverage for the home football games at New Sharon. I know our orthopedic people do other sideline coverage. I believe that they do Eddyville and Oskaloosa and William Penn and New Sharon, and I'm not sure if there's anything else in there or not. We do get a lot of joy out of that, and also we take care of the kids. A lot of those kids have come to us for sports physicals, so if there's a problem, we've seen them before the problem was there, so we know their baseline.
Well, I was going to say, I've heard the Mahaska Health staff that are on the sidelines cheering pretty hard. So
Yeah, we can get kind of involved in the games. And we like our kids to succeed, and we like to be part of their successes. You know, I just think it's a privilege to be able to care for people. And I love it.
There you go. Well, you can't say it any better than that. So,
Yeah.
all right. Thank you very much.
Thank you.